Louisiana.
Thank you, Madam President. I was presiding before the President was, and I heard several speeches by my colleagues on the Democratic side of the aisle speaking about the 1332 waiver process that the Trump administration is using to lower insurance premiums. And the kind of common refrain is that this is a terrible thing, that we're eroding protections that were in the Affordable Care Act, and we should preserve the Affordable Care Act as it is. And this is so ironic, Madam President, because the people who want to get rid of the Obamacare right now are actually running for president on the Democratic side of the ticket. If you ask Bernie Sanders if he wants to replace Obamacare, he raises his hand. If you ask Elizabeth Warren if she wants to replace Obamacare and force people to give up their employer-provided insurance, she raises her hand. Now, why do the presidential candidates, Democratic presidential candidates, sit there and say, hey, let's get rid of Obamacare, and when the administration does something positive to lower premiums, my Democratic colleagues stand up and decry this kind of assault upon whatever value they are speaking to? Well, I think the Democratic candidates running for president, are so aware that health care costs under Obama have skyrocketed. Let's see if I can find my figures here. But it's quite remarkable, Madam President. Here we go. Madam President, let's just speak a little bit about what has happened. Since 2008, since 2013, deductibles for someone with single coverage has increased by 53%. And despite deductibles going up to, say, $10,000, premiums have increased 20%. So the patient's out-of-pocket exposure is increasing both with the deductible and with their premium. For a family of four in Louisiana, we looked on healthcare.gov just walking here, $25,000 for the policy with an over $10,000 deductible. Now, Madam President, this is not affordable. So clearly, there's a concern about affordability. That's what the Trump administration has been trying to address. And frankly, that's what Bernie Sanders and Elizabeth Warren wish to have Americans sacrifice their employer-sponsored insurance to address. But my Democratic Senate colleagues don't want to do this. They would rather have all the protections of Obamacare, even if you cannot afford the policy. And truly, that is what we are to now. And now they then again speak of the waivers that the Trump administration is giving, somehow saying these are terrible things. But let me point out that in the 7 states with 1332 waivers granted under the Trump administration, premiums, health insurance premiums, have decreased by 7.5%. Some states have had a double-digit reduction. Maryland, for example, and I'm going to come back to Maryland, has had a 30% reduction in their health insurance premiums under the 1332 waiver given by the Trump administration. North Dakota had a 20% reduction. And what about if you didn't get a waiver? Madam President, in my state, which did not apply for a waiver, premiums have risen, are expected to rise 10% this coming year. 10%. So the family of four paying $25,000 a year with a $10,000 deductible will pay $27,500 next year with a $12,500 deductible, meaning they will be out almost $40,000, Madam President, $40,000 from their health insurance. I suspect there's a lot of families in my state that wouldn't mind if we applied for a waiver if we could just lower premiums instead of seeing out-of-pocket expense continue to rise. Now, there's a little bit of an irony here. Maryland has a legislature dominated by Democrats, and they actually got a 1332 waiver. So if my Democratic colleagues are speaking how terrible these waivers are, they should look back to states which Democrats control who are applying for these waivers. I'm told that Montana has a waiver. Montana with a Democratic governor who's running for president on the Democratic side of the ticket. Apparently, that person felt as if it was something he would sign into law and otherwise approve because it would be beneficial for the people in his state. I don't know why my Democratic Senate colleagues want Americans to pay more for insurance. Why do they insist on continuing to advocate for policies which make health insurance, so unaffordable? This is personal to me, aside from being an American, wanting all to have coverage. For 25 years, I worked in a hospital for the working poor, for the uninsured, trying to bring health care to those who could not otherwise afford. It has been my life mission, if you will, as a physician, to try and get health care to those who cannot have. And so when folks want to give them this great policy, but you can't afford it, but don't worry, it's a great policy if you can just afford it, I have to kind of smile. Like the Greek myth Tantalus, where you get the word tantalize from, where the prize was always just beyond the reach, always there to tempt, but could never have. And so you have a family making $120,000 a year, having to pay $25,000 for insurance with a $10,000 deductible. They're sacrificing so many things, it's almost tantalizing. But we're sure that this is the better state of affairs. Now, what the administration has done, they've given states flexibility to craft affordable options for families that do not have subsidies. It respects the fact that some states are different than other states. Imagine that. Alaska is different than Rhode Island. Alaska, if you laid it across a map of the lower 48, would stretch from Georgia to California, but has fewer people than Rhode Island. And Rhode Island, which is a postage stamp compared to Alaska, but has more people, those states are different, so allow them to have different healthcare systems. And by the way, when you do this, we are assured by the administration that they continue to enforce protections for those with pre-existing conditions and all other things that we as Americans, that we as Republicans, that I as a physician who have spent my life caring for the uninsured, value. So, Madam President, if health care is not affordable, it is not available. And what we've seen by the folks on the left who are concerned about health care costs is a doubling down on government control. They want to go for Medicare for all. They want to take away your employer-sponsored insurance. But at least they acknowledge that cost is a problem. What my Senate colleagues are not doing, the ones that are speaking today, is acknowledging that cost is a problem. And you can have the greatest plan in the world, and if it is unaffordable, then that greatness is ironic. It is on a piece of paper, but it's not real in someone's life. But what we have seen is that states, when they come to the federal government requesting permission to put in a program which is specific to the circumstances in their state, they're not only covering the citizens of their state, continuing to have protections for those with pre-existing conditions, but they're also lowering premiums by as much as 30%. And that is a good thing, and I have no clue why my Democratic colleagues do not want to see premiums lowered by 30%. Madam President, thank you, and I yield the floor.